Hi friends, I'm Priya Mistry, the TMJ Doc. Today I'm going to be talking to you about your eyes and how they can be affected by TMJD. Did your blurred vision come on the same time that your TMJD symptoms began? Did you get floaters in your eyes? How about eye twitching or light sensitivity? How about pain behind the eyes? Did your eyes tear up at random times? If you experienced any or all of these symptoms, please watch this video until the end to better understand how they may be related to your TMJD. For those of you who don't know me, I'm a general dentist with a practice in Portland, Oregon, where I am dedicated to taking care of patients with TMJ disorders. I work here with my mentor, Dr. Arthur L. Parker. If you haven't already, be sure to check out my Instagram handle. I post on Instagram very frequently, little tips, lots of trivia, general information about TMJ disorders. I'm trying to get better at posting on Twitter, so check me out there too, tweet. My handle at Instagram is _TMJ_doc. And on Twitter, it's at PriyaTMJ. So be sure to check them both out. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button because I post a new video every Friday with new information about TMJ disorders. I created this channel for patients, for people who are suffering from TMJ disorders, to find more information and potentially resources that can help them. So let's get right into it. Many of you may right now be thinking, how can a jaw problem affect the eyes? Well, if you've seen some of my other videos, you probably already know that TMJ disorders can affect many parts of the body, and the eyes are just one prime example of this. The reasons behind this are largely due to anatomy, specifically the anatomy of the trigeminal nerve and the anatomy of the sphenoid bone, what it houses and what its muscular attachments are. Let's start with the anatomy of the trigeminal nerve. The trigeminal nerve has three branches: the ophthalmic branch, the maxillary branch, and the mandibular branch. If the muscles around the trigeminal nerve are inflamed and edematous and swollen due to TMJD, that can then put pressure on the trigeminal nerve. If there's pressure being put on the trigeminal nerve, it's not out of the realm of possibilities that that pressure could also be put on the ophthalmic branch of that nerve, then leading to negative eye-related symptoms. I'm just trying to postulate as to how these eye-related symptoms can be related to TMJD, because I've certainly seen it in some of my patients, which I'll circle back around to later in this video. Please also be sure to check out my video called What is TMD? That talks more about muscle inflammation, muscle dysfunction, the swelling, the edema that can then lead to TMD, which is also known as the great imposter disease. So I won't go down that rabbit hole in this video, but there's a lot of information in that video. So be sure to check that out. It may help you understand more of what I just said. Let's move on to the sphenoid bone, which I personally think is the most amazing bone in the whole human body. But that's a topic for a whole other video, so I'll save that for another segment. The sphenoid bone is uniquely shaped, and it is one of the 7 bones that helps form the orbits, which house the eyes. This bone, the anatomy of it, has 2 plates called the pterygoid plates. Attached to these pterygoid plates are 2 muscles that are key players in TMJ disorders: the medial pterygoid muscle and the lateral pterygoid muscle. Both of these muscles, and particularly the lateral pterygoid muscle, which I call the troublemaker, can wreak havoc when they become dysfunctional. These muscles can become dysfunctional for a multitude of reasons: chronic clenching, chronic bruxing, the way the teeth fit together, or a bad bite, hormonal influences, postural discrepancies, whiplash incidents, and sometimes no obvious reason at all. When these muscles become dysfunctional, they get trapped in a chronic pain and spasm cycle, and that's when the symptoms begin. The lateral pterygoid muscle actually has fibers that extend behind our eyes, so it's easy to see how pain or pressure behind the eye is related to TMJD. Keep in mind that the sphenoid bone helps to form the orbit. So if the muscles that are attached to this bone are in a chronic pain and spasm cycle, it can then affect the orientation of the sphenoid bone in 3-dimensional space. If this orientation is affected enough, other eye-related symptoms can begin: blurred vision, floaters, etc. Keep in mind that flashing lights in the eyes may be due to retinal detachment. If you're experiencing this, seek the care of an ophthalmologist immediately. I have a wonderful patient named Jessica who was kind enough to do a testimonial for me, so please check that out if you have some time. One of her symptoms was that her right eye was tearing up all the time. Once we began her TMJD treatment, that symptom resolved. In her case, it took orthotics, myofascial release, and Botox for that particular symptom to resolve. If you watched my video on Botox, you know that I only use it a couple times a year, and Jessica's was one of those cases. Another patient of mine, we will call her Jennifer, started experiencing blurred vision and changes in her vision once her jaw locked. She wore glasses regularly, and so she asked her optometrist if this could be related to her TMJD. She was told no, and she was given a new prescription for her glasses. Jennifer is super smart though. She said to me, "My jaw is locked. I have excruciating headaches, neck pain, jaw pain, and ear pain. How could my sudden vision changes not be related to all of this?" Jennifer ended up not getting new glasses. She waited it out, and during the course of her TMJD treatment, her vision returned to normal. I hope this video provided you with some insight or some information, and that's really it, my friends. If you like what you heard, if you learned something new, click like below, subscribe to my channel, do all the things. And remember, my friends, you can never have TMI about TMJ. Thank you.